A lumpectomy is a removal of a lump in the breast with a margin of safety tissue, usually done for cancer. So when I started my practice 25 years ago, I would say a good portion of people kind of felt the lump and came in versus had it detected on an image. But if you go in and get a mammogram, the odds that your cancer will be detected are much higher, and it will be much smaller, on the order of 8 or 9 millimeters, which is about 1/3 of an inch. If you wait until you feel it, the average size then is closer to an inch in size and more difficult to treat. There are basically 2 operations for breast cancer. You can remove the lump, or you can remove the breast. We clearly wouldn't give people 2 choices if one were worse than the other. I think people make an assumption that if you only remove a little of the breast, that's not as good of an outcome for the cancer. But in fact, that's not true so long as people accept other treatment. So lumpectomy and mastectomy are both excellent treatments. Lumpectomy is less invasive. It's a smaller incision. It preserves the breast, the nipple, typically the contour of the breast, and so it's less body-altering than a mastectomy. Mastectomy generally involves, when you're doing it for cancer, involves removing the nipple and the areola. The breast can be reconstructed, but it can't always be reconstructed right away. If their breast cancer is found by a mammogram, it's usually also checked with an ultrasound. We'll place a little marking clip in the breast cancer at the time we biopsy it. And then once we're sure it's breast cancer, we also place a radar clip that we can detect with a radar device outside the body. So we put that little marking clip in the breast, and then when we take him to the operating room, we shine our radar detector over it, and it beeps kind of like a metal detector. It shows us exactly where the breast cancer is. We make an incision over that area. We remove the lump and some tissue around it. Cancer is named by where it begins, right? So breast cancer begins in the breast, and then if it spreads to your brain or your lungs, it's still breast cancer. So what I say to people is cutting off your breast doesn't save your life, right? Because it's cancer that spreads that harms you. And so more radical surgery is not always the answer. And so when we think of cancer, we think of now and treating them and getting over the cancer, but what's really the most exciting part is the survivorship, meaning them moving on with the rest of their life. And we want them to have a long life and a life, free of side effects from treatment that we give them to the extent that is possible. It's a journey that we go through together. And it's a journey that I've been on many times with people, but I'm aware that it's their first time. And I care about what happens to them. Connecting to the patients helps me take better care of them.